sir, in today's age, AI is a big thing. I mean, it's a growing thing in every genre, in every field. What do you really think about AI in healthcare?
So let me start by saying it's when people say it's artificial intelligence, I think it's not artificial intelligence. It actually is cumulated augmented intelligence. So what we've done is we've really replicated our own thinking as to how humans think and made machines that emulate us but do it in a much better and efficient way. But let me put it this way, this is the third big transformation of this planet. The first was the agricultural revolution, when we moved away from trying to use our hands as tools and started creating tools for tilling the land, which was the first revolution, happened in around the 1500s. The second big revolution was the computer revolution, when we started digitizing a lot of stuff. And this is the third big disruptive revolution, which is going to affect every aspect of human life. Anyone who assumes that it is not for them purely because they are doing their process in a much more manual way, I guarantee you they're all living in cuckoo land. And the only exception to this is going to be the absolute blue-collar worker who's doing physical jobs. And there the threat remains with a robotic evolution, which will be happening cumulatively with the AI. But let me now get back to what does it mean for medicine. Medicine has always been nothing more than data analysis based on what you've been taught and what is your experience by treating hundreds and hundreds of patients. Some people say, oh, there's an intuitive aspect of medicine, and I disagree. I think what happens is experience kind of gives you the right options. We call it intuition. But I'm yet to find someone who did not need the information first, right? The intuition only is after the information has been provided. So I'm looking at AI revolution in healthcare with a great deal of excitement and anxiety at the same time.
That was interesting because I have read that medical images can also be done by AI. Like they can be analyzed by the AI apparently. So what do you really think of those kind of technologies?
So this is where I said it's a very, very disruptive evolution. Now, what is an image interpretation? It's identifying what looks out of place, right? So when I look at a CT scan, as long as it looks to what I think is normal, I'm okay. My radiologist has been trained to start looking at what looks abnormal or out of place. But he does it with his own eyes, right? Now today, combine the power of 1,000 eyes,
Right.
which is doing the analysis in microseconds, and it's possible. Now herein lies the $1,000,000 question. Is it trustworthy enough yet? And the answer is no. Today, medical models are very good. They're getting more and more capable, but they're still not at the stage where we've evaluated their safety from a decision-making perspective. So I feel that there is a great revolution or evolution that's going to happen in radiology, where we will need fewer and fewer radiologists who are augmented with technology to put that final human assurance on the analysis part so that another clinician can act on it. Given a few years down the line, I have no idea what it will look like. The reason being that Microsoft has already released a paper 2 weeks ago where they've created models which can look at any kind of image, not just radiology, any image. That image could be a video, that image could be a picture, that image could be a photo. And they are so confident about their analytical process that they're claiming more than 90% accuracy, which is way better than what humans can do. Now, just for a moment, pause and say that we can use this ability to predict diseases. It sounds very futuristic, doesn't it? Whereby an AI algorithm is looking at swastika
Right.
and knowing everything about how her body is functioning. Now,
Yeah.
this has suddenly been born in the realm of possibility. It's not real yet. I completely agree. But as we start adding layers
Right.
after layers to what we currently have, that day is not far when we'll say, oh, you know what? AI has diagnosed that I've got hypertension, so can you check my blood pressure? And believe you me, that's not too far. I've been working on PPG signals already, and I know that we can evaluate a lot of your vital parameters by looking at you. I can do an ECG by looking at someone. Now, today, it sounds like, oh, how is that even possible? Answer is,
Exactly.
it has been possible, it has been proven, it has been done, right? So, it is a question is going to come as to how we now reverse engineer what we previously used to think that it can only be done by integrating human intelligence with information flow. Now it is going to be the reverse. The information flow will directly interact with technology and provide inputs to the human to take a decision. So from a decision maker role, we're going to go for a gatekeeper role. So that's the evolution.
Amazing. But sir, what do you really think how AI can be cooperated with healthcare in the next coming, per se, 5 years? So how, from now's landscape to the next 5 years landscape, how that is going
Yeah.
to evolve?
Well, that's very interesting. So healthcare is probably one of the most resistant sectors to change. And the reason for that, it was very human facing. My processes are all about interacting with a human and taking decisions. So the way I see it is there are so many interesting tools that will slowly get integrated in the hospital or in the clinic space, which will start augmenting the doctor's productivity. But there's something else that's going to happen. These AI tools are going to reach the patients directly, or what we call the consumer directly. When we got Google, I started getting patients who actually came with a differential diagnosis based on their own assessment of Google symptoms, right? Now, with the next bot, I'm going to get a diagnosis to say, Doctor, my bot says this is my diagnosis. Please cross confirm. Not can you check me. They're only going to come for reassurance and revalidation of what the bot is telling them. Now, that actually has a profound implication for medicine. And that profound implication means that the kind of power of decision making that doctors held is going to start getting less and less. And I can see that healthcare will have to adapt to this. So we will start seeing consumerism of healthcare, whether we like it or not. I'll give a simple analogy to make you understand this. So when laptops were first brought into the market, it was a big, big, expensive toy which everyone loved. If anything went wrong with it, I had to take it to someone who was an expert and who looked into it, and then he fixed it for me, even if it was a minor problem. As the assessment part got easier and people started knowing what to do, today my 10-year-old son effectively can open up a laptop and replace things doing accurately because he's got the right instructions. And he's doing this without fear. In other words, he's not damaging anything. Now just apply this analogy to patients. Now, what if tomorrow the patient knows that if he has hypertension, this is what he's expected to do, this is the change he's going to have. Now, today, the barrier is going to be how do I get my prescription? Because prescription is a controlled entity. But what if tomorrow you just have online doctors who merely sign your prescription, who are not really partaking in any analysis or merely offering their signature for a value? Suddenly, you see disruption that is unimaginable. So I don't think this is all likely in 5 years. I see that this will keep evolving purely because we need accuracy before we can implement it in healthcare. I see that a lot of talent which is currently driven towards medicine is slowly going to get attracted towards technology. So they act as a bridge between today's doctors and tomorrow's doctors. But I can tell you that 5 years down the line, healthcare is going to look very, very different than what it is today. I don't know whether you've ever been a a Star Trek fan. But as a child, I used to watch Star Trek, and they used to have a tricorder.
Not,
They used to do zoom, 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 and within 30 seconds, there was a full analysis of what's wrong with the patient, right?
yeah, yeah.
Science fiction, but Swastika, we are slowly making that real. We are making it happen.
Yes.
The horizon of 5 years, it's open to guess whether it'll happen, but I can tell you, we are moving in that direction.
That is something I'm really looking forward to it, because it is something that is, I mean, to dream about, and also to see it coming, in the future. To think about it is also a really great thing, and I think it will also empower the healthcare at the same time.
So there's something else that's happening that I want you to be aware of, and that is the rise of wearables and technology that is accessible directly to the patient. Now, today, if you wear an Apple Watch, your blood pressure, sorry, your heart rate, your SpO2, your ECG is automatically captured. As wearables become accessible, people are going to self-diagnose a lot of stuff. But there are also technologies as evolved as an ultrasound scan, which is slowly getting consumerized. Now, imagine a day when I've got some pain in the abdomen, I've got my own ultrasound at home, I keep it on my tummy, transmit my images to a sonologist or to an AI bot. The bot is telling me that your problem is XYZ. And now I'm contacting the hospital to say, I've got XYZ problem. Do you have a surgeon available to treat this condition now?
Yes, that is
So
something one will want.
it's happening. I can assure you this is not something that I'm imagining. I'm seeing this when I talk with other leaders in this industry, when I talk with other people who are working in similar areas. A lot of the stuff which we took from for granted that only doctors are trained to do it, I'm telling you that's no longer the case. I'll give you a very interesting example of a company in Bangalore that I'm aware of. And all they do is they track your eye movement, your fine eye movement. And believe me, if you have any inner ear trouble, that your eye actually has a very minor tremor. It is called nystagmus. But the same thing happens if you have a lot of other conditions, including a brain tumor. What this company did, build a bot which can accurately assess your eye movement and tell you with 95% confidence what your problem is. Can you imagine? When I'm feeling giddy, I just look at the bot. It tells me, oh, you got an inner ear problem. Then I know, okay, then I just have to go to an ENT guy and get some antihistaminics, right? I
Yes,
no longer need a neurologist. I don't have to worry about a brain tumor. I don't have to worry about any other things because my bot told me so. Can
yes,
you imagine what we've just done here? We've taken the anxiety of not knowing what's wrong with us straight away from the patient. If you start applying that
yeah,
thought
exactly.
to a lot of conditions where people are going to doctor not for treatment but for reassurance, you will see what the impact on medicine is going to be.
So, sir, keeping this in mind, you really think, like, with this, like with AI and healthcare, will AI empower the doctors or the healthcare professions in terms of patient care, or to identify or to tell how the diagnosis is gonna, come out, or with maybe the medicines or something related to that?
Absolutely. So, Swastika, that's already happening. In fact, we work at the forefront of that. At Axonic Health, I build these products to say a doctor is only a human. Why can't I augment him? Why can't I give him the right
Right.
inputs when he needs them? Why can't I make sure that every doctor is capable of very deep, detailed specialist knowledge? So that's happening. Adaptation, that's going to be very variable. My belief is the younger doctors are going to adapt it a lot faster, and the older doctors are going to just retire as aged dinosaurs. Because typically that's how I've seen evolution happen with technology adaptation in healthcare, right? The work has already started.
Right.
Today, I know a lot of my colleagues who are actually using AI tools in their daily practice.
Like, do you really think, like, with AI tools, will it free up doctors' time? For example, if a doctor is able to see 5 to 10 doctors a day, like patients a day, will that doctor be able to see maybe 20 patients a day or 30 patients a day with the help of AI?
Absolutely. The productivity increase is going to be exponential. It's not going to be just 5 to 20. It actually, let me put it this way. What if I have a second layer where anyone who's actually normal is not even coming to the doctor? So let's assume you've got a cough and a cold. The bot is saying you've got a cough and a cold. The cross check, the investigations confirm that there's nothing sinister happening. The prescription is issued. The doctor's e-sign is attached. You wouldn't even see that patient. The patient automatically got seen purely because I built the framework in such a way that I only start putting my input where I'm needed, where I feel, I have to take a call
Right.
or a decision. So you can see some tremendous changes in the way we do our work.
Right. But sir, do you really think this can be a next big thing in the healthcare? Or will like a lot of doctors, as you said, are using it already. But how much time it might take to be a regular thing, like for the coming future? How all the doctors can accept that AI is empowering them, not taking over them?
As I told, we are resistant to change. So the way it is going to happen is very
Right.
interesting. The new entrants who are trying to now come and set up their professions, they are the ones who are going to start looking for tools which will help them leapfrog the non-transformers, as I call them. Now, what that suddenly does is, previously that used to be a very gradual process. Now it's going to be sudden, and there's going to be a fear of missing out. That FOMO factor is where you'll see a lot of adaptation. I see a 3 year horizon for that to happen, but not beyond that. And I'll tell you why 3 years. I need some more time before the models are a lot more mature. And then I need a little more time to integrate them with existing data sources. That will happen hopefully in the next 12
Right.
months. Now imagine beyond the next 12 months, what if you are not talking with a doctor, but you think you're talking with a doctor? The workflow will have a digital clone of a doctor. You interact with him, the entire analysis happens,
Mhm.
the inputs happen. You are thinking in your mind
Right.
you're still dealing with him because he's emoting like the doctor, he's looking, he's smiling, he's happy, everything like the real doctor. And the real doctor is
Right.
only alerted if there is something untowards. Sounds very disturbing, doesn't it?
It is scary and exciting, but at the same time, it's scary as well.
Yes. So what I'm saying is, see, we have to harness this technology. The world transformations are given as far as I'm concerned. This is going to be a very disruptive transformation. The bigger challenge is going to be how do
Right.
we do meaningful engagement to the vast masses because a lot of work is now happening automatically. But that's a different problem. That's not for me to solve. That's for the politicians and the decision makers to solve. But when I look at healthcare,
Yes.
I have no doubt in my mind that healthcare is on the cusp of transformation.
So, sir, the last question that I have in my mind related to AI will be, for example, today, as you said, AI can be the next some years, it can be, bots, it can be something, it can be something. But for the next 1 year, what
Yeah.
are the things that a healthcare profession can incorporate in terms of AI tools or incorporate in terms of freeing that healthcare profession's
I'll
time
tell you,
to
what
be
is
more
happening. For
like.
instance, I'll tell you, in medicine, there are so many small processes which don't really need intelligence, but still consume a lot of
Right.
effort. So, for instance, when you see a patient, you have to dictate a
Right.
letter. That can be automated. When I prescribe someone, I have to check for drug-drug interaction. That's automated. When I want to prescribe, I
Okay.
have AI bots that actually show you what potentially are the requirements to prescribe that drug. Especially as newer and newer drugs are coming, that becomes a godsend, right? Now let's
Right.
assume
Right.
I'm in a doubt where I don't know whether it is this or that because it's kind of, oh, it could be this, it could also be that. Now I have the ability to summon
Right.
a differential diagnosis, give it context, and say what is more likely. So all these tools are slowly getting adapted.
Right.
The biggest
Right.
barrier that's already been broken is language. So
Mm-hmm.
can you imagine a Arabic patient speaking with a Marathi doctor and actually getting his care? That's real today. Swastika, like I said, this is happening. If you come to our offices, I'll show you this in real time.
Great discussion in terms of like how language can be cut down, like the barrier of language can be cut down because of the AI.
Not just language, the entire piece of communication, which is transfer of my information to you or your information to me,
Right.
that is going to transform. It is not just
Yes.
going to be a one modality, it is going to be across modalities. You'll be very surprised as to how human communication is going to be so different
Yes.
as we move forward. I'm sure you heard about the Neuralink chip, right? Where a man is controlling a
Yes.
computer through a
Yes.
chip in his brain. Now, just imagine a world where everyone has a chip and no one is using his mouth. They're talking telepathically with each other.
Right.
So these are, they
Yes.
sound like very impossible ideas, but today we live in a world where everything is possible.
So yeah, so it was amazing because right now AI is taking over almost every field, And to think of AI in healthcare is something really interesting. And I think as an individual, I'm really excited to see what's coming up for us, because I think for the smallest things we have to think a lot, and we get a lot anxious. As you said, we think a lot, and there is a lot of negativity. I think that can be cut down by the AI tools that's coming.
So you'd be surprised. AI is powerful even to start doing thought analysis in the future. So that's scary because that really puts us in a very different place. But let me say this before we conclude: that keep your eyes and minds open
Yes, sir.
and embrace change for your own
Mhm.
progress. Thank you so
Okay,
much
sir.
for a second.
Thank you so much, sir. Thank you so much for your great thoughts.